Warrington Optimum Wellness. Anyone want to hazard a guess as to how long the practice has actually been here for?
I came 20 years ago.
Okay, so it's obviously been in existence for more than 20 years. So the practice has actually been around for a long time. It's been around since around about 1988. Okay, so that's when it first started. Who was it that you saw 20 years ago?
You, actually.
Okay.
Obviously changed a lot.
Yes, I was going to say, I normally can remember a face, but...
Yes, definitely.
So, I have been here for many of those years, and I have taken like a long journey with regards to what it is that I have focused on during my career within chiropractic. So when my children were little, my focus was on paediatrics, and then as time has gone by, we've got the equipment in the room here that you kind of see, and you might be familiar with like Pilates reformer style of equipment. It's not dissimilar, but it's not exactly the same story.
So ours was quite recent in September. Amelia was trying to dress on for a wedding, and I noticed that her shoulder was out a little bit. We went to the doctors about it, who kind of said, we think she's got scoliosis, and we'll do a referral to Walter Hay, which they've done. But they said that the weight was around 20 weeks just to be seen.
Yeah.
I thought it was going a bit bigger, so I went for a private assessment and a private X-ray, which has then been sent over to Walter Hay. And luckily enough, they've kind of moved her up the waiting list. So we've got your first appointment Walter Hay tomorrow, haven't we?
Okay, brilliant.
So
you're going to go on with a little bit more information as well.
Yeah, that's why I've come tonight really. I mean, the curve is just over 20 at the minute, so it's not a big curve at the moment, but because she's only 12, she's got, is it a RISA score? Or
a RISA
score, 0, so she's still got quite a lot of growing to do, and you know, based on the reading that we've seen online and what have you, it's suggesting a brace now, but I don't know whether that'll happen tomorrow or not, so
highly
keen to find out what that's
Okay, so this is the definition. It's like a sideways bending of the spine, a greater than 10 degrees. So, you know, you might say that her curvature is small, and I would say that, you know, that all depends upon the degree. Okay.
Yeah.
So, apart from the definition, we can say that, like, you know, I'm not going to read all these bits here, but we can say that around about, on average, it says around under 5% of the population will have a scoliosis. We see a larger portion of people with scoliosis. Anyone want to hazard a guess why it is we might see people less than 5% of the population?
Because they come here for a different reason and you notice it?
Sometimes.
Maybe a denser population. There's more children in the area.
Nope.
It's hereditary. My son's got it.
So, not just that. And no. Okay. So it's a mechanical curvature of the spine. We take care of the spine in terms of a chiropractic approach. Therefore, oftentimes people will present with pain. Okay, in a hip, in a leg, somewhere else in the upper back, in the shoulder blade sort of area, or in the neck, could be anywhere. But that's why it is that we will see a higher proportion. So a higher proportion of our, even if you want to call yourselves like a patient population group, we will see a higher proportion of people than this kind of like 5%. So, you know, we know that it's actually more in the female population than it is in the male population, okay, but it can happen in men as well. And then here, obviously, it says that, you know, that you're going to become aware of it around the age of 10 to 12 also. So it's rare for it to be that you're going to be aware of some of the scoliosis from birth, right? It tends to be a developmental type of scenario. Anyone want to hazard a guess why it's more in women or females than in males?
Hormones.
That's one of the theories, but there's no actual known reason why it is. Okay, there is a hereditary component to it.
My daughter hasn't got it, but my son has.
Yeah, so there is a hereditary component, but like you just said, that it doesn't necessarily follow through that just because one generation's got it, that the next generation will have it as well. Okay, so this is obviously a relatively severe picture that we've got, but oftentimes, we have had people that have come to see us who've had this degree of change, and it's almost like we're the first people that they've actually ever seen about it as well. So I don't know why that is, but who knows? As a parent, I know that I'm very aware, but it could be that they, kids at a certain age might start taking themselves off to the bathroom to go and wash themselves, or swimming costumes, blah, blah, blah. There's so many different reasons why it is that it can take some time before it is that we can see someone. So we have seen 16, 18, 20 plus year old people who are like, oh, I think I've got a bit of a curve in my back, but because you're not necessarily having someone take an actual photo of your back, you don't know what you look like from behind. And from the front, this person might just think, oh, I'm a bit over to one side. But actually, when you're actually doing a physical evaluation, we can see that, that we've got this asymmetry.
Can I just ask a question on that slide, sorry? So where it says there, can develop back pain. So Amelia's been having back pain for a long time, but the consultant at Spire said that we shouldn't get back pain with it. Is that a thing? Or?
So what I just said to you right at the beginning was that the reason that we see a higher proportion of people with scoliosis is because it's a mechanical dysfunction. Once you start getting those curve changes, the mechanics of your body is going to be altered. So your spine should obviously be straight, and if it's got a bend in it, it doesn't have to be super severe. It depends upon many other different factors as well. You're going to get back pain. So I would say that it's not that it's always associated, but there is an association,
right.
Which is why it is that we tend to uncover it. You've got a curvature.
To be fair, that picture is pretty painful.
Yeah, exactly. Yeah, but but some people don't have any pain. So that's the thing is that it doesn't always go hand in hand, that you're going to have that degree of curvature and the person may have pain. And, and so this is there's the imbalance between the two situations. So scoliosis awareness. So we know that what we want to know is we want to recognise the signs of scoliosis. So why would you want to do this? You'd want to do this. I know that we're going to get later into what it is that we can do for it as well. But why do you want to do it? Well, you want to do it because of the fact that if you have scoliosis yourself, and so do you have scoliosis yourself that you're aware of?
Yeah.
Okay, not that you're aware of. We want to know, is it going to be something that we can pick up early in our children or loved one or family, whatever, friends? Is it something that we're going to be able to pick up early for them so that we can do something with it? Because we know that early detection is actually in a younger person is going to be key in terms of them progressing, basically. Okay, so the fact that you've been picked up already is amazing. What happens next is going to be really important, I would say, for the lack of progression. That's what you're trying to do because you're so young. Like Mum was saying, that if you've got growth plates, which is what the Rissa sign is across the top of the pelvis, if the growth plates are open, you're going to keep growing, your body's still building, you've got a chance of progression. That's why it is that we look at the Rissa sign. So who can it affect? Everybody. All sorts of ages and groups of people. So it could be that you are an older adult. So an older adult could be two different ways that you do, or many different ways that you can develop a scoliosis. So older adult, we're talking about kind of over the age of 60. So over the age of 60, one way which you can develop a scoliosis is something called de novo scoliosis. That means that 1 in 3 adults over the age of 60, men and women equally, will develop a curvature, a scoliosis. Okay, that's 1 in 3. So 1, 2, you're going to have 1, 1, 2, you're going to have 1, that kind of thing. Okay, so it's really important for us to recognise how that will potentially present. So 1 in 3 people is going to get a curvature. How does that impact you? Many, many different ways. but we're not here to discuss that. The other way that we know that an older adult will have a curvature is because they started off with a curve at the age of 10 or 12, and it's just, they've had it for all their life, okay? And then there are other ways that you potentially can develop a curvature as well. It could be as a result of a really short leg.
I've got one leg short.
Okay? It doesn't always follow that the side of shortness is the side where the body kind of shifts over to. Okay? So it would be something that definitely we'd recommend getting an investigation on, because you don't just, with somebody that's got the shorter leg, depending upon how it is that you're presenting, will then depend upon whether or not you're going to get balanced out with a lift underneath the heel, for example. You know, that's something that we routinely look at. Because if you put a heel lift in someone who's got a curvature, but it's on the wrong side for them, it would actually make the curve worse, right? So it doesn't always follow that it's going to be automatically that we're going to, that you get a heel lift. So on this image here, we can see that we've got all age groups that can be affected, male and female. So why does it happen? Idiopathic. So we've said that there may be a hormonal component, but that's still very, very out there. We just don't know why it is that every single person will develop a curvature. It's very much out there in terms of a reason or a rationale behind it. So there might be the family link. We've just said, we've already talked about that there could be a hereditary component. But we know the other important thing is that understanding that what you might see on an X-ray is a two-dimensional picture. Like you're seeing something that is actually what we would classify as a three-dimensional curve, but it's projecting on an X-ray as being quite flat. And so what you don't necessarily understand, would you mind getting me involved with the spine, please? Is that what you may not always understand is that it's, like I said, it's a three-dimensional. I hate using the word deformity, but that's the language that we use. Okay.
Sideways as well as.
So you can have. Let's hope that this model moves. So if this is supposed to be your spine from the front, and this is supposed to be the spine from the side, when we have a three-dimensional disfigurement, I don't know whether this will actually move. What will happen is that the spine will twist. Okay, it will bend, and it can be forwards and back in the wrong position as well. So usually what we'll see is, depending upon where the curve is, if it's in the low back or in the mid back, if you've got something in the mid back higher up, your spine usually is super flat. And the reason it's flat is because of the fact that you're supposed to have a curve out like this, but if you've got a twist and you've got a bend, then that flattens out that spine. And that's why it is that sometimes you'll see that the shoulder blades become more prominent because of the fact that we've got this disorientation within the spine there, okay? So when you're seeing something on an X-ray, sometimes it can project worse, and sometimes it will project better than the actual misalignment. Does that make sense to everybody, yeah? Okay, so we do know, like it says on the image here, that it's not just about the spine, that the curve is there, but what can happen when it's at a younger age is that the bones will change shape, okay? So we've already discussed that it's somebody that maybe started off with a curvature that when they were young, and then it develops on into adulthood as well. Early detection matters, so we've already covered this as well. It's really important that you have the appropriate intervention. So you've just said that you had some physiotherapy, you're under the chiropractor right now. Have you had any treatment at all so far?
Rods.
So you've had the Warrington rods put in already?
Yeah,
okay. When you were 10, okay, and you're at older age tomorrow, hopefully getting some further investigations done. So you've had the X-ray done already, and is it in the lumbar spine or in the thoracic or both? So thoracic and lumbars, and you don't know at the moment?
No, I've had treatment. I've seen chiropractic before. I've been to the hospital for my back and stuff like that. I'm not really sure what's going on. I've also got I've also been told I've got one leg short than the other. My hips are all over the place. So it's just, yeah.
There's a bit of unravelling to do.
Yeah, I've played rugby since I was 6 years old as well, so that's not helped.
Possibly or possibly not, we don't know, okay? So, research. So there's the Scoliosis Research Society, try saying that, quickly, and that there's that there are documented benefits of the earlier detection and the non-surgical management. So, for those of you that haven't had the rods put in or haven't looked at the brace option just yet, then this is what it is that we are presenting here, is then potentially is a non-surgical management approach that can be taken. So those of you that have seen a chiropractor before, or are currently under chiropractic as well, what is it that you're having done differently to how it is that someone without a curvature would have done? So, and it would be the same applied to you for the physiotherapy approach that you had.
Mine was just recommendation to carry on with Pilates. Helpful and just some stretching exercises really.
Okay.
Mainly to relieve the pressure on the hip.
Got it. Okay, because that's your overriding symptom is the hip
I
pain.
now developed pains in my knees as well, but I don't know if that's got anything to do with it. Or
Okay.
it's just old age.
Okay. Okey-dokey. So if you're under the chiro at the moment, what are they doing that is different specifically for your curvature?
Attempting to align it or maintain it or release the muscles around it.
Okay. So when they're attempting, I'm just going to focus on the ones that you've given back to me.
Yes.
So when they're attempting to align it, let's just say, okay, what does that mean?
So they are maximising its potential as it is. Is what I feel they're doing. So obviously I'm getting adjusted.
Yeah.
I don't quite know what question you're asking me.
So the question I'm asking is that anybody that's had any intervention, what you want to know is are they doing anything specially different for you with your curvature, the scoliosis that you've got, in comparison to someone who doesn't have scoliosis? That's my question.
Yeah. So I would say that they are assessing my spine as it is and maximising its potential as it is.
Fine. So they're not actually realigning anything.
Well, no,
Okay. So because I think because the wording is important.
Yeah.
Okay.
Yeah.
So a lot of people associate, the clicking and the manipulation and the noise that you might hear with what's called an adjustment. A lot of people will misunderstand that for lots of different reasons. TikTok does a great job of, overestimating what it is that a chiropractor can achieve in one visit. And the word realignment gets brandished about a lot. But when you're having an adjustment, very little is being realigned. Okay, so when you receive an adjustment, it's actually improving the mobility of that segment, which may be necessary. However, without the correct information in terms of x-rays, analysis, is this the best thing that you can be doing? Are there other things that you should be doing to prevent the progression of the curve? Okay, and that's where it is like you need to be going to see someone if you're interested in making sure that the curve doesn't progress, that you need to go and see someone who has more information and more knowledge and not just applying their routine chiro approach or routine physio approach. I know in this area, you can Google it if you want to, ChatGPT, whatever you want to do, but I know in this area I wouldn't even know that there is a specialist physiotherapy scoliosis approach to what it is that is recommended for scoliosis. Like, everyone heard of Schroff exercises? Yeah, so so it's a specialist approach. Schroff is super complex. You start, be my guest and look on YouTube. Like, you'll be bedazzled by what it is that, how it is that potentially suggesting you take care of. And it is important for you to do exercise, 100%, but it's very complex. The Schroff approach is very, very complex. So definitely exercise is important, but there are specific exercises that you should be doing when you have scoliosis, and that is imparted to you when you go and see someone who has specialist knowledge. Okay, so you're going to find that out hopefully from Alder Hay, because they're going to take approaches that are research and evidence based. They're not just going to do routine stuff with you. Where did you have your Harrington rods? Alder Hay. Yeah. So, and how old are you now? Sorry, 21. So you've had them in for 10 years, 9 years. Yeah. Okay, so yeah, you know, we know that that is an approach, but if it can be avoided, then that's potentially preferable. Okay, because we know that there's a limitation that you get as soon as you have the rods put in the spine. So we know that so there isn't like we know. I don't know. There's just nothing in place in schools now. Everything is being cut back on. So then you're relying on either an information approach or an awareness approach, and those are the two ways. So either you know about it because it's in the family, or you know somebody observes it and you do something about it, and then it depends upon who it is that you go and see as to what's going to be done about it further. So
two grandchildren, both have had the rods. One was discovered whilst he was actually showering after a football match.
Yeah.
His coach noticed.
Yeah.
And the other one was a dancer.
Mm-hmm.
And a dance teacher
Noticed it, exactly. So this is what I'm saying is that because we don't have any routine screenings of any description in schools now. That's just that time went away a long time ago. So we know that there's nothing routine that is occurring. So it is, like I said, it is down to people sharing information and also being aware of other people's posture and alignment basically as well. So we know that you're looking to see, when you're doing a standing assessment, we can see that what it says here is you have the person standing with their feet slightly hip distance apart, and you're going to just relax their arms by the sides there to have a look. And then we've got the different things that you're going to see. So you're potentially going to see like one shoulder blade may be winging, one shoulder blade might be higher. You might notice a difference in the waist, so like the asymmetry within the waist. And then you might also have like an actual visible curve that you can see, but it depends upon the person. I don't know, and where are you going to routinely see this? Like you said, potentially in a shower, or like in a ballet class, something like that, or a dance class, because otherwise everyone's covered in clothes. You're not going to see it through clothing very often. So we've got the forward bending assessment, which is really important for you to look at as well. So you will see with someone from the side, you will see like a rib humping on one side in comparison to the other side. That's something that you can quite easily get someone else to look at for you as well. So yeah, we can see that we've got one of them is in the low back, and one of them is in the picture on the left is of a humping in the thoracic spine, which is your upper back, and on the right hand side it's a picture of a misalignment in the lumbar spine. So these are then, like I said, you want to make sure that you're going to see someone who's got a proper qualification in scoliosis. I would say that because it's hard, it's not an easy thing, it's not an easy subject matter to come across. A lot of people will dabble, but I think you want to consider whether or not you're actually going to see someone who's actually going to make a difference for you, and what your goal is as well. Is it, like we said, to stop the progression, or is it just for symptomatic relief, or a bit of both? Hopefully that would be the idea. But at the practice here, what we do is that we always go off what it is that your goals are. We might want you to have a straight spine, for example, just putting it out there. But if your goal is just going to be symptom relief, then we're not going to push you towards that. So things that you can do at home. So we've talked about the early detection. So there is an app that you can get, and it's this app here. So it's a web-based screen tool, and it's called Scoliosis. So if you want to get your camera down and take a picture of that, then that might be probably a good thing for you to do, just in terms of what it is that you can look to get information from. Okay, so anyone can use it like it says at any time. So the website is there, app.scolioscreening.com. Has anyone come across any apps that they've used at all? So no? Yeah, this is it's really, really, really informative. So you've got your okay, so that's like it. So this is, if you've got anybody that you know about that is concerned about scoliosis, then this is an amazing piece of information that you can just share with them about them knowing how to take care of it or get it at least assessed. It's like a super quick initial assessment themselves. So we've got the different ways that we're going to look at this here. So we know that that there are certain groups that are higher risk, and then the second section here is what happens if your scoliosis isn't taken care of appropriately. So super big curves will want small. We also know that in certain instances the curve can progress so quickly, because it's just like a growth spurt. You know, like if you've seen a child with a growth spurt, you know that it's almost like over the summer holidays they go from being little to being really tall. And yeah, so that's why you've got to catch it at the right time. So
the same for older people?
No, not necessarily. It depends upon the situation with your bone quality and your bone density. So the issue with females, older females, is that you are at risk of osteoporosis. That already means that if you've got a small curve and then you've got big issues with osteoporosis, that will then push you down that path a bit faster as well. So that's why it is that your exercises are really important, because they are going to provide you with some framework and some resistance for the general natural progression. So we've got like a normal spine, and then we've got somebody who's just within a year that progression has occurred. I took care of someone within the practice here who came to see me. So she was working as an assistant here. Her daughter, I used to see her when she was really, really young. She had x-rays taken with me, and she then decided that she didn't want to have any care with me. Then, a number of years later, she came back to see me. We took x-rays again. The curve had progressed significantly. She still didn't want to do anything about it. All I could do was refer her back to a GP, let the GP know. But she was adamant she didn't want a brace, because she felt that it was just going to be too interfering with her life. So, like we said, each person is different, and you've got to have the right thing for you at the time. So firstly, I would say, is to establish whether you've actually got scoliosis. Okay? Why am I saying that? Is because even as recently as, I don't know, 15 years ago, I would say, probably longer than that, there are people that are being diagnosed with scoliosis. I've had many here at the practice who have got a scoliosis, and actually what they've got is they don't have the X-ray looks like they've got a curvature, but it doesn't depict all the different signs of a scoliosis, which is some rotation, a translation, and then a bending back over as well. Okay, so they don't have all of those signs. So what we do is, if you're having an assessment here, then what we will do is that we'll assess you physically externally first, take posture pictures, etc. in sports type of clothing, and then look to see, right, does it look like you maybe just shifted over? Because if you are shifted over, a bit like, if you don't mind me sharing your story, Anna?
Yeah.
Anna's got, when she started working here a couple of years ago, she came in with different symptoms, no curvature diagnosed, but I was like, Anna, you're really shifted over there. So what we found that she's got a large leg length discrepancy. But were you misdiagnosed with scoliosis at one point?
They never really
Investigated it. Okay,
No.
so this is the misdiagnosis that we get. So we often do see people who are, not saying that in your situation that is the same, because you've already been diagnosed with a 20-degree curve. You've already had a Harrington ordinance, so you're clearly someone who's on a curvature, scoliosis. But there are people that get misdiagnosed with a scoliosis and they don't actually have a curvature. What they've got is a shift of their spine over to the side because they've got a big leg length discrepancy. So it's really important that you get the correct diagnosis to begin with, because otherwise you're barking up the wrong tree, right? So that's why it is, and that will never progress. That's never going to get worse, because it's not because you've got a scoliosis, it's because you've got a short leg that the body's shifted over, and it's doing the right, it's correcting itself as best as it possibly can. So we evaluate that in a particular way, right? Then we have those that have a curvature. You're going to have options depending upon what age you're at and what it is you want to do. One of the options is to do what we call Scoliosis balance exercises, for which I am a qualified practitioner, but that's not a sell point for this evening. This evening is about you getting information about whether it's something that you want to pursue here or not. So Scoliosis balance is a specific type of scoliosis exercises that is not as complex as Schroff, that we unravel, right, what is it you need to do? What are your big misalignments? Do you have a big twist in the body? Is your shoulder forwards, so that you can unravel, and we do that bespoke one-on-one, not in the routine way that I take care of patients here. So Scoliosis balance exercises, you do have to have x-rays, and we've got the facility to be able to take the x-rays here, and we can mark them up with the specialist software that we've got as well. We could do some work with you in the office here with the traction equipment that we've got, depends upon what it is that you want to do. Or the last option would be to be looking at a brace. We don't do the bracing here, but I've got colleagues that are dotted around the country that we could potentially send you to for a bracing evaluation. I've got one of my colleagues who does online consultations, so that that's one way of getting around it. And then the others do a combination of face-to-face. So there's a guy in Nottingham, and there's Complete Chiropractic. I can't remember exactly where he's based, but he's another one of my colleagues. It's like very, very specialist scoliosis approaches, and always looking at advancing themselves as well. So they're doing things that are in the best interests of their patients, because if a brace is not appropriate for you, they're not going to give you a brace, because they're not cheap and they're private. It's not going to be something, and we want great outcomes for anybody that comes to see us or that we work in collaboration with. So that's pretty much the options that you've got out there, which is to either do nothing, see someone who's got some specialist knowledge, because you want to get your assessment right first. that's all that I will say to you is that establish whether or not it's a curvature, then look and see what it is. But I would say to you, what you don't want to do is wait 20 weeks. Because in 20 weeks, the curve can go from 10 degrees to 20 degrees, and then you're like almost at the point, not I'm going to say at the point of no return, but then you've progressed, and you're like, well, flipping out, could have done something with this in this time, you know. So yeah. So how it is that we work here is that you would, you know, we do a consultation, but then it's not necessarily that everyone just follows the same flow with regards to what it is that we then, you know, what it is that we then recommend to you. What questions have you got about anything that I've talked about so far, and have any of your questions been answered, or have you still got loads? And if so, now is the time to ask those.
I think really I was just, me personally, sorry, is I was just looking at maybe, like I said, I didn't realise what it was until I was coming. I've only, because somebody put me onto you about chiropractor, and I looked on the page and I saw this, I thought, okay, maybe I'll look at that, and look at it, and then realised maybe I need to rule that out.
Yes.
Which is the first thing I would like to do potentially.
Yeah.
And then find out if it is just sciatica I've got. So
Yeah.
I've been diagnosed with sciatica, but not an MRI scan, not anything. I've seen like somebody here who said I've got it, and I saw somebody down south who said I've got it as well.
Right. Okay.
Chiropractor.
Yeah.
But some of the symptoms you're saying could potentially mean I've got a curve. I don't think I have.
Got it.
I don't think I have, but
Yeah.
I think it's maybe something I need to rule out, and then maybe if I've not got that, hopefully not. But you know,
Then there's something else, it's a different route.
That's,
Yeah.
you know,
And have you got anything that's been answered, or is there any other questions that this has raised for you?
I think for me, the bit about genetics and families, because I know that lady there said she's got 2 grandchildren with it, which, you know, it's not that common having 2 grandchildren unless it is genetic, I guess.
They're from different sides of the family.
Oh, are they?
Not
So,
related to each other.
yeah, so that's like really like, wow.
Yeah.
And I guess my question around that is that in our family we've got children that have got like hip dysplasia, and they've like had cone head and been problem with the bone, and I'm just wondering if there's a genetic that, I mean, they might have a scoliosis, but they got those conditions. Is there something there?
Yes, there potentially is, but what you'd have to do is look to see online. I would suggest go onto like a medical research forum rather than ChatGPT, so that you've got all the actual names of the conditions to look to see, is there an association? Like you said, it could be that, like you said, that you've got that, but somebody else had a different type of scenario.
And they're all in the same family from the same grandmother, which I just wondered if it was like a bone situation.
Yeah, understood. Understood.
And then MRIs, I've heard that people have MRIs for scoliosis, but what are the MRIs looking for?
To look to see if there is any other reason for the scoliosis.
Right.
Yeah, so you know, is there like any other inherited condition that is associated with the scoliosis?
Yeah.
So the rare genetic disorders are often associated with scoliosis as well, but you kind of pick those up when the children are much younger.
Yeah.
Okay. Yeah. What about for yourself?
It's just, I get a lot of pain like in my shoulders, a lot of tension, I don't know if that's stress or because of the scoliosis, and the same at the bottom, it's like a burning sensation. I don't know whether it's, you're just going to have to live with it, or is there anything I can do to kind of...
Well, you're pretty young to have to live with it, do you know what I mean? Like, so you've got a long life ahead of you, so I would suggest that it is something that looks, you're not going to do anything for the rod, okay, the rod is there, but what you have to do is to make sure that it's as comfortable as it can be. And this is the thing with surgery, is that the NHS, the procedures that you have done are brilliant, absolutely brilliant for the surgery. The aftercare is severely lacking, you know, because, and that's where it is that people like ourselves come into play, right? So yeah, we're going to talk to you about what it is that you can potentially do, because I would say it's not something that you should have to live with. because that's a lot of medication for the rest of your life. You know that you shouldn't have to. Have. There are plenty of ways around it.
Can you bend over with your rods in your back?
Like doing toes?
Yeah, you can. Have you got any limitations?
The only thing I can't do is trampoline because I'm under pressure. But
You can do everything, you go on rides and stuff like that.
yeah.
It's not like a.
I know, but it's just that I didn't know, because I've heard that there's like, there's rods, but then I've also heard of like fusion, which I think is a bit different, isn't it?
Fusion surgery is definitely much more limiting.
Newer.
It's
Newer,
much
isn't
more limiting. But
Right.
what they're trying to do is, in terms of surgical intervention, is they're trying to limit the rods.
Yeah.
Okay, so they will do them in smaller areas. But this is like emerging stuff again.
Yeah.
You know, it's not something that.
Because that's all that will have been around when you were having
Yes.
those done.
Yeah,
Yeah.
when I found out that I had it, I was literally sat on my mum's knee, she literally like rubbed her hand, she was like, you shoulder don't feel
Yeah.
that.
How old was she
I
then?
was 10.
So they did it pretty quick then?
Yeah,
for
we
you?
literally did it because they were like, because of the degree it was, if we leave it any longer, it'll start to twist and like swishing over and stuff like that.
Mhm.
So yeah, they like had it.
Was bracing an option back then? It was.
But the
Oh,
thing
did
is, with the bracing, again, the NHS bracing that you get is different to the type of bracing that I recommend with these colleagues that I've got. So the NHS bracing that you get just fixes it in place. It's not to correct the curve at all.
Right.
Whereas the bracing that we recommend, that you have the consultation for, potentially, is very much about realigning the spine so that you're actually, because you're still growing, you've got a chance of it actually significantly improving.
Is the NHS one just to avoid it getting any worse?
Yeah. But again, you know, the problem with that is though, is that there's no evidence that it actually stops it
No,
from
it's
getting
just
any worse.
one of my grandchildren, one of the ones that's had the rod, did have a brace for about a year prior to having the rod.
It's a soft brace. It's not like a
yeah,
hard
it's,
brace.
it's not like having a plastic cast.
Did they wear it all the time?
I was a
Yes,
leather
I was.
corset back in the day because I was 13 when I was diagnosed.
Yeah.
So mine was a leather corset with a metal rod and it was holding my head here. Wore it for about a year and it was basically just to stop the curvature going over 40 degrees. And I
Yeah,
think
that's right. Yeah.
It got to 36. And then I stopped growing, so they said,
It's
It's
once
not
you
common.
stop growing, isn't it? It kind of.
yeah, it says had it been 40 degrees it would have
So
continued.
this is the kind of thing
Yeah.
that helps to push against the actual misalignment, and that is the thing that makes the difference. So we know that because this is the type of bracing that I would recommend. So I'm thinking about if it was my family, my children, whatever, this is the approach that I would take. I wouldn't just be taking a one route approach. I would be taking like a multiple approach there. So we can see that we've gone from a 33-degree curve on the picture on the left, and then moved down to a 6-degree curve on that image there. But you have to get it at the right time, and it is quick. So yeah, you're in the right situation right now to get it investigated, but I wouldn't want to be waiting.
But once you get it to the pictures on the right there, after that treatment, and you get it there, I think there's certain exercise you've got to do to make sure you get that
Definitely,
constant
to keep it
to
there.
keep it there.
Yeah.
But eventually, after probably a few years doing those exercises and stuff like that, there's enough stability to keep it there, is it? Or will it?
It's always something that you have to keep up.
Right.
You have to, like your core work, definitely.
Yeah.
Because that, but it depends upon where the curve is, what the degree of curvature, etc. is as well. And I would say that you want to make sure that it's routinely monitored as well. So somebody like this, who started off with a 33-degree curve, you'd want to probably look at getting an image done at least every couple of years, to make sure that there's no big changes. And for women, like we've said, it could be at times when there's big hormonal changes that
The reason I was asking that question is because if it is diagnosed later on, and then you do get yourself sorted out and paid 22 months or whatever it may be, obviously the older you get, it gets a bit harder to exercise and stuff like that. So it's just like, you know, you potentially are you going to fall back into that.
So that's where it is that any kind of maintenance program
is
recommended.
It's always hard, isn't it, to keep that exercise going.
Yeah. So you're seeing someone every kind of like 6 to 8 weeks. The recommended program of care that we do here is coming back on a weekly or a monthly basis, because we know that that's what the research and the evidence tells us. So we follow that, and that's what it is that we do. So I don't recommend anything that isn't kind of like evidence based. So that's what we recommend. So plus it's a little bit of accountability. Plus it's that you've got someone that is aware. Not seeing you every day, but you're seeing on enough of a time frame for us to be able to notice the differences in you as well, and having like a postural assessment, a screening, that kind of thing, or you get someone like, I don't know, annually, if you can, to get a picture of you, same place, same background, that kind of thing, from behind, that sort of thing. So, I've got patients that we do that with routinely. It's so easy with the mobile phone now, with the camera roll on there, to get someone to look at you, same lighting, like, you know what I mean, like it's just that consistency that you can then look back and you think, oh, actually, it's either better or it's worse or there's no change. That's great, and that could be for many, many different reasons that you could do that.
Would you exercise in a brace or would you take it off, like PE and stuff like that?
You can do. You can exercise in it. Yeah. You're meant to you're trying to move around as normally as you can, but with those fixed braces, the ones that I recommend, the Scoliosis braces, you're wearing them for a lot of hours, like 23 hours.
So just take them out for showering and stuff.
Yeah, because you want it's like a fixed brace on your teeth. If you want to get the change, it has to be there for a lot of hours.
So with the curvature there, obviously that's going to have an effect on your discs. Which obviously will deteriorate, potentially also make them bulge. So potentially having a slight curve or whatever, it potentially might bring another bulging disc or something like that potentially as well, or is that not the case?
Can do. It can do. Hip pain.
Yeah.
So it just depends upon the person and what activities you've done as to what it is that your symptoms are actually going to be. Yeah. So here, so you can see that this is the Scoliosis brace, if you like. But I do know that the NHS braces are still soft ones. They're not hard, and they do get. There are some places. I think there's like a London Scoliosis clinic or something that is one of the specialist places in the UK which does do scoliosis work. But I don't know. There's not that many dotted around the country. Old Hay, we're lucky, is on our doorstep.